What if your period wasn't just a monthly cycle but a health report card? Every shade of period blood carries a message from your body. Some colors are completely normal, while others may be warning signs you should never ignore. Bright red period blood is often one of the clearest signs that your menstrual cycle is functioning normally. This color usually appears during the first 1 to 3 days of your period, when the flow is strongest and the uterine lining is shedding efficiently. It indicates that the blood is fresh and leaving the body quickly, without staying long enough to darken or oxidize. For many women, this is a reassuring signal that circulation is good and the uterus is doing its job smoothly. When your period blood is bright red, it often reflects balanced hormone levels, particularly healthy estrogen and progesterone activity. These hormones work together to build and then shed the uterine lining in a predictable way. A steady, bright red flow can suggest that ovulation is occurring regularly and that the menstrual cycle is well regulated. It may also indicate that the uterus is contracting effectively to expel blood, reducing the chances of excessive clotting or prolonged bleeding. Bright red blood is also commonly associated with a moderate flow that feels manageable, even if cramps are present. While some discomfort is normal, this color alone does not usually signal a problem. Many healthcare providers consider it the ideal menstrual blood color because it reflects freshen, oxygenation, and healthy uterine activity. However, context always matters. If bright red bleeding continues heavily for many days or appears outside your regular cycle, it may require attention. Extremely heavy bright red bleeding that soaks through pads or tampons quickly can sometimes point to hormonal imbalance or other conditions, but on its own, bright red period blood during your normal cycle is generally a positive sign. It's your body showing that your reproductive system is working in harmony, doing exactly what it was designed to do. Dark red or maroon period blood is very common and, in most cases, completely normal. This color usually appears in the middle or toward the end of your menstrual cycle. When the flow begins to slow down, the darker shade happens because the blood has stayed in the uterus a little longer before leaving the body, allowing it to oxidize when exposed to air. This natural process changes the color from bright red to deep red or even wine-like tones for many women. Dark red or maroon blood is a regular part of every period and does not signal any health problem. It often indicates that the uterus is gradually finishing the shedding of its lining. As contractions slow and the flow becomes lighter, blood exits more slowly, which explains the deeper color. This is especially common during the last few days of menstruation or during overnight flow. Hormonal balance can also play a role. Stable estrogen and progesterone levels help regulate how quickly the uterine lining sheds. When this balance is maintained, darker blood at certain points in the cycle is simply part of a healthy rhythm. Small clots may also appear with dark red blood, which is usually normal as long as they are not large or frequent. However, attention should be paid to accompanying symptoms. If dark red or maroon blood comes with severe pain, a foul odor, dizziness, or unusually heavy bleeding that lasts longer than a week, it may be worth consulting a healthcare provider. In rare cases, prolonged dark bleeding could be linked to hormonal imbalances or uterine conditions. Most of the time, though, dark red or maroon period blood is just your body completing its natural cleansing process, rather than being a cause for concern. It is often a sign that your menstrual cycle is progressing normally and steadily. Pink period blood is often lighter in color and may appear diluted or mixed with clear cervical fluid. This usually happens at the very beginning or end of a menstrual cycle, and in many cases, it is not dangerous. However, when pink blood appears frequently or becomes a regular pattern, it can be a signal from your body that something may be out of balance, most commonly related to low estrogen levels. Estrogen plays a crucial role in building the uterine lining each month. When estrogen levels are lower than normal, the lining may not thicken as much as it should. As a result, there is less tissue to shed during your period, causing the blood to appear lighter or pink instead of the usual red. This can happen during times of high stress, sudden weight loss, extreme dieting, or excessive exercise, all of which can suppress estrogen production. Pink blood may also occur during certain life stages, such as puberty or premenopause, when hormone levels naturally fluctuate. In these phases, the body is adjusting, and menstrual changes, including lighter or pink bleeding, are fairly common. Hormonal birth control can also cause pink spotting, especially when stopping, or missing pills. That said, pink blood should not be ignored if it comes with other symptoms. Fatigue, missed periods, mood changes, vaginal dryness, or difficulty concentrating may also point to hormonal imbalance. In rare cases, persistent pink bleeding outside of a normal cycle could be linked to infections or other underlying issues, and should be checked by a healthcare professional. While occasional pink period blood is usually harmless, recurring changes are your body's way of asking for attention. Proper nutrition, rest, stress management, and medical guidance when needed can help restore balance. Paying attention to these subtle signals allows you to respond early and protect your overall reproductive health. Orange or grey period blood is less common and should always be taken seriously, as these colors can indicate potential health concerns. Orange blood often appears when menstrual blood mixes with cervical fluid. But when the color is clearly orange, especially bright or cloudy, it may be a sign of a bacterial infection or a sexually transmitted infection. The unusual color can result from changes in vaginal pH caused by harmful bacteria, which alters the appearance of discharge and blood. Grey period blood is even more concerning. It is often associated with infections such as bacterial vaginosis and may appear thick, pale, or unusually dull in color. Grey discharge or blood is frequently accompanied by a strong, unpleasant odor, itching, burning, or pelvic discomfort. These symptoms are your body's way of signaling that something is wrong and needs prompt attention. Infections that cause orange or grey bleeding should not be ignored, as untreated vaginal or uterine infections can lead to more serious complications, including pelvic inflammatory disease and fertility issues. These colors are not considered a normal part of the menstrual cycle, regardless of timing. Unlike brown or dark red blood, which usually reflects old blood, grey or orange tones typically point to an external problem rather than a natural process. It's important to note that these warning signs are not a reason for panic, but they are a reason for action. Early diagnosis and treatment often resolve the issue quickly and prevent long-term effects. Good hygiene, safe sexual practices, and regular gynecological checkups play an important role in prevention. If you ever notice orange or grey blood during your period, especially if it appears suddenly or repeatedly, listening to your body is essential. Seeking medical advice early can protect your reproductive health and give you peace of mind. Your period should inform you, not alarm you, but certain colors are signals that should never be ignored. Heavy menstrual flow with large clots can be one of the most noticeable and concerning changes during a period, and while some variation is normal, there are times when it deserves closer attention. Small clots are common, especially on heavier days, because the body releases anticoagulants to keep blood flowing. When the flow is very heavy, these substances may not work fast enough, allowing clots to form. Clots smaller than a coin occurring occasionally are usually not a cause for worry. However, consistently passing large clots or experiencing an unusually heavy flow may signal that something deeper is happening in the body. Heavy bleeding that requires changing pads or tampons every 1 to 2 hours, lasts longer than 7 days, or interferes with daily activities is not considered normal. This kind of flow can be linked to hormonal imbalances, particularly excess estrogen, which can cause the uterine lining to become thicker and shed more heavily. Conditions such as fibroids, polyps, thyroid disorders, or endometriosis can also contribute to heavy bleeding and large clots. In some cases, iron deficiency anemia may develop due to prolonged blood loss, leading to fatigue, weakness, dizziness, or shortness of breath. These symptoms are important signals that the body is struggling to keep up. Life stages matters. WES. Teenagers and women approaching menopause may experience heavier or irregular periods due to natural hormonal fluctuations. While this can be normal, it should still be monitored carefully. Sudden changes in flow, especially if they appear later in life, should never be ignored. Heavy flow and large clots are your body's way of asking for attention. Paying close attention to patterns and symptoms and seeking medical advice when bleeding feels excessive can help identify issues early and protect long-term reproductive and overall health.